you got people and, they're concerned about going to the dentist. It's scary. They've had a past bad experience. Nobody likes going to the dentist. Don't take that personal.
I don't.
Okay, good. But, who likes to go to the dentist? So what can you tell us about what you do to help people who have that fear or concern?
Well, that is very common. So I tell to my patients, don't feel alone in that boat, because it is very common. But there are good news to that. That fear is usually associated with a very bad experience during childhood. And the truth is, the only way to get rid of that and overcome that fear is confronting that fear. How do you do that? You have to come to the dentist, and the dentist will help you overcome that fear. When you have a fear and you have the same experience, let's say you come to my office and then I make the procedure. Let's say you have fear to having your teeth clean, but then you have a positive experience. What happened? That fear comes from your brain. It's stuck in there. It's a recording that you have in there. And every time you step into a dental office, it reminds you a bad experience.
Yeah, the smell, the sound of the drill.
The bad experience. So the only way to overcome it is having a lot of good experiences connected to this, to the same situation. Then you will erase that trauma.
That's a good
put
point.
it that way.
So if I could ask, it's a total good point. If I could ask, what do you do to help make that experience a good experience? Because, there's a lot of people have had bad experiences, and who likes the needle and the drill? So,
well, the first thing that I do is identifying and recognizing that the patient is in fear because of that. Not trying to diminish that fear, because it exists, it is in there. And then I will talk to you as a patient and guide you through the process. How do I do it? I explain what I'm going to do. I make the patient feel confident in the process, and feel confident in me, that me as a professional will help him overcome that fear. And what usually happens, and what has happened to me through the years, is that the patient is grateful, because at the end of the treatment, 1 month, 2 months, even 2 visits, the patient is less afraid and end up being able to do it by themselves and not afraid anymore to come to the dentist.
Yes.
Because that fear is a personal problem. It's not only coming to the dentist, it's something that is a root inside them and is growing up. As much as they reject the dental visit,
sure,
that fear is growing up. So you need to do the opposite. Come over, find the right person to guide you through the process, and you will be able to overcome it, and will feel confident yourself at the end of the process that, for the rest of your life, you will be taking care of your mouth. Because what usually happens with those patients is that they are in so much fear. They reject dental treatment, and they only go to the dentist when they are in pain.
Which is way too late.
They don't prevent,
right.
Correct. They don't prevent because of fear.
Right.
So they don't usually go to recall appointments or prevention treatment, cleanings or fluorides or anything that may be prevention treatment. And then they only come when they're in pain. So at the end of their life, their mouth is very deteriorated and very difficult to treat because they were in fear from the beginning.
So would you say that you guys are pretty good on taking care of people who have fear of the dentist? You got things in place?
I am, and I like to do it, and I feel really happy, not only as a dentist, but as a person, that I'm being able to help somebody to overcome that problem. Because
nice.
it is a problem.